Hi, everybody. Welcome to GW Center for Integrative Medicine YouTube channel. I'm your co-host, Dr. Kogan, Chief Medical Officer, Associate Professor of Medicine at GW. So sorry about a little bit of a poor quality today. I'm traveling, but I still decided to make this video. So rapamycin. Rapamycin for longevity. Rapamycin as a senolytic, literally meaning the medication that prolongs life, or a substance rather that prolongs life. I've decided to record it now because in the last couple of weeks I had several patients ask me about it, and it's been an ongoing, of course, story. And there are many very respected physicians like Peter Attia, for example, that advocate its use, and they're not. At least Peter is not shining away from the fact that he's taking it himself. So I have never fully embraced rapamycin, and I'll show you reason in a second, including this most recent study that I'm going to briefly discuss. And the reason is I have a hard time accepting any treatment where I know there is not just chance for serious side effects, but that the medication for sure has negative metabolic impacts despite positive too. This whole story of rapamycin reminds me quite a bit of what happened with metformin. Metformin has been a favorite for a lot of the biohackers and longevity experts for a long time. And then, of course, with more data came out, turned out it actually did not truly advanced life, and it really hasn't been all that great, and there was some long-term negative impact. So metformin fell out of favor. So let's come back to rapamycin. So what do we know about rapamycin, and why is it so big, right? Why is it probably considered at this point maybe even number one medication, not the substance, because there's a lot of supplements, but number one medication that's thought to be a life prolonging? Well, there's a lot of understanding. Rapamycin is an inhibitor of mTOR, and mTOR is thought to be a critical pathway within the process of aging. Rapamycin belongs to this class of drugs or into multiple derivatives that are similar to rapamycin called rapalogs. I'm not going to discuss other medications. There are actually several of them. Some of them are better than others. There's a reason why we mostly talk about rapamycin. I think it's studied the most, but also it tends to be a bit safer, even though it may not be the most effective rapalog that's out there. And mTOR is a critical pathway in a regulation of aging itself. So inhibiting it would make sense. And critically important, the fact that actually, in theory, inhibition of mTOR will have a very broad impact. It should beneficially impact cardiovascular system. It should beneficially impact neurocognitive decline and endocrine system. It should improve muscular function as well as immune system. So the reason I decided to also talk about this today, not only because the fact that patients been asking me, but also because I want to show you this study. So what I'm going to do is I'm going to go ahead and share my screen as usual. All right, there we go. So this is a study that just came out. I'm recording this video in first week of February, and as you can see that this study is literally, I think it's dates this month, so it's dates February. Actually, I'm sorry, it dates 1 year ago, so dates of February 2024. But it's still very, very fresh study. And what I want to show you particularly is what they did is they basically took lots of existing studies. So they analyzed 18,000 articles and they selected 19, and they looked at all of them collectively to make conclusions. So I'm not going to bore you with all these details. Of course, I'm going to put the link to the article. But what I want to show you is this two pictures. So each study that they analyzed basically produced this kind of a breakdown: positive, relatively positive, or mildly positive, no effect, and not assessed on each system. And you can see that there's a lot of greens and there's some yellows. And then the second, probably even more important. So here what they did is they took positive and green, and you can see that each one of this is an organ. So for example, there were several studies showing benefits for cardiovascular system, and then there were several studies showing sort of no effect. And in fact, you can see that pretty much there is just lots of discrepancies. So for example, immune system, this kind of a blue dot here, you have beneficial effect, no effect, and negative effects. So complete inconsistency, complete lack of kind of consensus as to what is that beneficial impact. And I'm not going to come back to the study again. If you want to read the whole thing, I'll post it there. I just want to talk a little bit more about some other important aspects of this study as well as other studies. And it's interesting that, how do we fully assess effect on humans if you have so many different inconclusive results? Well, the problem is that all of this study that were analyzed, rapamycin wasn't used the way it's used for longevity, which again, I'll talk about that in a couple of minutes. They looked at the data of rapamycin when it's given for something else. Rapamycin is sometimes given as an immune suppressant in certain conditions, and it's just been assessed as a treatment for other illnesses or for other conditions. And so within that scope, can we actually use that data for longevity? Not clear either. But why is, in essence, where's this all came from? Like, why is rapamycin? Well, it's not only the fact that mTOR is inhibited, and that's probably a good thing. The bigger problem is, or the bigger issue is that when the rapamycin was used as a senolytic for a variety of different animal systems, whether it's small organisms like yeast or mice, there is a substantial life prolongation, anywhere from 20 to 60%. So some of the studies in animals show pretty significant improved longevity. Can we translate this to humans? Well, that's the key question. So what was the problems that this recent Lancet study identified? Well, it turned out that it's almost invariably negatively impacts cholesterol, and there was a significant increase in overall infections when they looked at composites of all the studies. It's kind of counterintuitive. I just told you that the immune system improves. Well, yes, immune system's supposed to improve. What rather supposed to improve is aging of immune system. But remember what I just said, rapamycin is an immune suppressant, even though at low dose it's supposed to be a mild immune suppressant. But actually there is an increased risk of infections, and it's not very clear how would you discern that. And of course, risk for infections can be monitored, but still. So now let me come back to my opinion on this, right? So why do I think the prime time is not anywhere near for rapamycin? Well, there's two problems. So problem number one, just like with metformin, I actually have a feeling that until we know for sure that this shift in cholesterol and potentially even some other metabolic concerns are proven to be not significant or proven not to be offsetting any benefit of the rapamycin elsewhere, I think it would be unclear whether it's worth taking. And the main reason actually why I think that's the case is because I actually think that we should be affecting mTOR with natural substances. I don't actually think that we do have to give everybody drug when we have, at least a dozen of molecules that beneficially impact mTOR. Many of them are very well known. They used quite a bit. I'm going to give you a couple of names. So EGCG from green tea. So those of you who drink a lot of green tea, try to drink either more matcha or just drink a lot of green tea, or you can take EGCG in capsules. Quercetin and fecitin. So those are known anti-inflammatory molecules. Turmeric or curcumin. And there's other molecules too. So I'm just mentioning few. I decided not to make this all about mTOR because I think there could be a whole lecture about mTOR. I may do this in the future. I just want to bring these molecules here just for full comparison and also to support why I'm not necessarily advocating for the rapamycin and why I'm not taking it. So now, let's say that you decide that my information is unsatisfactory for you. You're already taking, or you're choosing to take rapamycin, which I actually would say that's fine. I mean, I think there's definitely pros and cons, and if you read literature somewhat differently, or you may listen to Peter or some other experts who actually support its use, I think it's fine to do. Now, how would you do it, and what do you need to do practically? Well, first of all, I think you need to understand that the dosing of rapamycin for longevity is quite different from the other conditions. So you would need to take it on a probably weekly basis. That's the most common suggested prescription. And you would start with a dose of somewhere between 4 to 6 milligrams, depending on your age, maybe some other conditions, and conversation with your provider. Probably 6 milligrams is the most common starting dose once a week. And then you would need to carefully continue assessing a couple of things. So you want to assess complete blood count to make sure your white count doesn't go down. And you also want to assess cholesterol closely, make sure it doesn't change. And if it does change, then you're going to have to make a decision whether it's worth continuing rapamycin and maybe doing so, because there's so many different ways to lower cholesterol with natural substances, exercise, etc. So, but obviously, if the white count goes down or you start having infections, I mean, that's a different conversation. Although I think from practical perspective, my understanding that it's not actually all that commonly happens. But, the problem is, how do you assess that? People often have infections, urinary tract infection, herpes, viral infections, bacterial infections. It's hard to say. I mean, is rapamycin now doing this? Because you may not have had this before, now you do. So it's going to be not easy to assess. Of course, cholesterol monitoring is a lot easier. Your numbers, if they change, you adjust accordingly, or you simply choose not to take the medication anymore, not to take rapamycin. So that's for now. I think the story of rapamycin will be quickly changing. There's a lot of interest in this. There is definitely ongoing assessments. I do hope that there will be an investment and a full assessment for a pretty long trial. Something that would need the trial like this will have to take at least couple of years, and probably better 5, to continue to assess that balance of pluses and minuses. And I, of course, hope that pluses will outweigh any potential risks. Now, finally, I'm going to conclude with at least the Lancet, and this is probably one of the more comprehensive analysis, did say that there was no serious side effects. That's why I'm neutral about if somebody decides to take it. I think it's completely okay given where the current science is. And then you're making a personal decision. My personal decision of suppressing mTOR with natural products simply relies on the fact that I do think it's safer in the long run. And there could be other consideration. If mTOR, the rapamycin could be cheaper, it could be covered by insurance. It's a generic drug. It's not going to be all that expensive versus spending money on supplements. The thing is that the supplements I just mentioned, they actually have a lot bigger benefits. So they're not just mTOR. They have lots of other things, like turmeric is a potent anti-inflammatory. EGCG is a very potent antioxidant and can help to deal with some other free radical damage coming into your system. The ficitin and quercetin are very potent antihistamine products. So I actually take that because I do have history of asthma, and I periodically do have allergic reactions, which I really like, particularly quercetin, to take for it. So I hope this was helpful. Again, the links are going to be in the description for the video to the study. I may put a couple other links there for the rapamycin, just in case those of you who want to learn more, then you have access to others. I believe that Peter Attia had a specific episode on rapamycin, so if I find that, I'll of course post that as well. Stay safe, and regardless of whether you're gonna in some point in the future think about taking rapamycin or not, I think do research mTOR. It's a very interesting topic, and I think that most people should be paying attention to it, and most people should be doing lifestyle modification. Exercise is, by the way, really good for the inhibiting mTOR, but also, of course, the supplements that I mentioned. And I'm probably going to mention some others in description, so I'll make a bit more longer description for the video. Bye, everybody. Stay well.